down and I can't see you, please go ahead and use the comment section. I can see that very well. Um, not really sure what you guys can see. I can only see my screen. So somebody speak up if you can't hear me. So um, Jessie called me, and I'll give you an introduction to who I am, but she called me and we talked over this and what I could present to you. And one of the things that we talked about was how broad the audience may be. And so we were preparing for teachers and talking about classroom strategies. And then we also talked about how different professionals may log on. So instead of a traditional presentation, it's going to feel more like a workshop. And since there are only 10 of us, having a lot of time to share and discuss, hopefully we can find that really valuable and mix in what I've brought to give you, and then what you already are experiencing. So um, now, if you can see my screen, it says, now let's get acquainted. So I'm Dr. Shelby Dorsey, and I'm a board certified behavior analyst, and I'm the director of Waypoint Behavioral Health Solutions, which serves the DFW area in Texas. However, I live in rural West Texas and work primarily virtual, only going in person every once in a while. So what's unique is that I have I live in a rural area. I'm the only behavior analyst in like 100 miles from me, but there's not even any place that serves ABA services around me. And so I really like coming to groups and to states like you guys, where I work in Oklahoma a lot, where we may go miles and miles without ABA services. And so everyone is learning what they are, how they can be used, the different ways they can be used, and keeping up with the research. And so I hope that we can do that today. I primarily specialize in autism intervention and clinical behavior and analysis, but I was a teacher and I taught general education, special education, and actually in all three elementary, middle school, and high school in my teaching career. I have a bachelor's degree in education, a master's degree in counseling, and my PhD is from the University of Oklahoma in special education with an emphasis on ABA. And so I add this part that, anyone who's a behavior analyst knows that there's no such thing as a 9 to 5 behavior analyst. But if we're pretending that there is, outside of that, I love doing presentations like this. I love talking to small community groups. I like teaching and sharing. I even have on here that I love fashion, and I share a lot of my life through Instagram, which is at Dr. Shelby Dorsey. And you can roll your eyes if you think that Instagram is lame, and that's okay. But that's where all the young professionals hide out to connect. And that's how Jessie and I met and how I got here today. So if it's not your thing, I understand. But if it is, I'd love to meet you on the Instagram platform as well. And so a little bit about me is I'm married to my husband, Jalen, and we've been business partners for 12 years. We've been married since 2016, so less than 12 years. And he has like the coolest job in the world, which he's the DJ for the Oklahoma City Thunder NBA team. And I never can leave that out because it just seems too cool. Like, who else does something like that? Like, I didn't even know that was a job when I was young. And so he does that, and I have 2 children, Tatum, 15, and Violet, 4. And they have their days. So I feel you with your children that you said, their diagnoses. We have a plethora of diagnoses at my house, it feels like. I am autistic, and I only found out when I was 30, but I also suffer from chronic illness and ADHD. So part of why I like to do this as well is that I always talk to the groups and say, I was your student. And I know how I was treated, and I know I now understand what I needed and what could have been provided had people known what to do with me, but they didn't. And they didn't know what complex trauma looked like from just being autistic. And then, there's other things that other people experience. And so that really builds on where I'm coming from in the science, but also where I'm coming from as an educator is that I'm using my lived experience, the experience that I've had with my children who are neurodivergent, and then through my professional lens. Anybody have any questions? Everybody's like, no, you're just regular. Nothing to ask there. Okay, so now I have real questions that you can ask or that you can answer. Is before we get started, will you use the chat and let me know what your current setting is? So you can use age group, you can use subject, you can use if you're obviously not in a classroom, which some of you aren't. If you're the BCBA for this, can you tell me a little bit about who your population is? Um, and then as you do that, if you have a really short, easy answer, then before logging on today, could you have explained ABA in an elevator? So, your elevator pitch. Could you have explained what ABA is before logging on today? And I always like to ask that question because I have teachers, another school professional that will say like, I've heard of it, but I'm not really sure. And so there's a big difference in you've heard of it or you can explain it. And so I always like to add that part in so that I'm not over talking or under talking the foundational elements that you may care about and you may not. I'm going to type mine in as well. What about the perfect. How many people do we have on? We have 10 including me. So everybody should answer. It'll be easy to count.
Sorry, I had a long answer.
No, I love it. Elizabeth, your answer is exactly why I love to ask this question is because yeah, we do monitor behaviors and we create behavior plans as needed. And if we're coming from that lens, it's easier for me to give information that feeds into that lens and not require partially explain ABA. Okay, so we have a wide range of people, and do we have anyone that is in a classroom setting? I know that Michelle, you said very small school, only teacher, but are you in a classroom setting or are you an over? I think someone is raising their hand. I can see a hand emoji, but I can't see who it might be.
Elizabeth is raising her hand, saying she's in the classroom as well.
Oh, okay. Thank you, Elizabeth. Is she the only one?
Looks like Elizabeth and Michelle are in the classroom setting.
Elizabeth and Michelle. Yep. Okay. So as as Jesse and I were brainstorming what I would bring to you today and how I could make this like this time together really informative and realistically informative, not by just saying, oh, this is ABA and this is the research, but saying like, what can we actually do? How can we actually use that? And so after running a couple of current literature reviews, there is a list that are clear behavioral signs that, or extrinsic, if you prefer that language, that we can observe on the outside that may indicate trauma. And so this these are not things that I made up and it's so innovative that you can't believe you came here today and learned all of this cool stuff. These are things that you've probably heard about, talked about in trauma informed care, in CEUs, and possibly in your degree programs. However, viewing it from a behavior analytic lens looks a little different, and we have some different uses for why we would describe it in a behavior analytic way. And one of the benefits is that we are able to write observable data, or take data on observable behaviors and then track it by even writing narratives. If you are working with if you are a teacher and you are writing like, this happened, this is what it looked like, this is what they said, this is how this is what happened first, then this behavior happened, then this consequence happened. As you're writing those behaviors, we could look through this as like a checklist to see what signs are showing, what are they not showing. If you have someone on your caseload that you think may be indicating trauma, but you have never had a list that just said, like, here's a list that I can look at and I can check these off. This is where that you may find, this is what you may find most useful that you actually take home and like print out. And after this meeting, I'm going to send a version that looks like a checklist that's not in a presentation format, so that if all you wanted was this list in a checklist format, so that when you are intaking a client or intaking a student, and you notice that their behaviors seem to be of concern, but you don't have their medical history or their history of trauma, then you could go through this and work through them one-on-one. I feel a bit redundant reading these out loud with 10 of us and the screen has been up, so I'm sure you've read them. But I would love to have some back and forth commentary about if you are in whatever setting that you're in, what you're finding to be difficult about, okay, I need to indicate that this child has trauma, or maybe I already know that they have trauma and they are showing these signs. Where is your stick point? Where are you at in your job that's thinking, I should go to this presentation today because this is what they're talking about and I need more information about that? Does anybody have, like, they came in with a goal and they have something that is a little more specific?
I would
And you
say
can talk or use the chat.
for my early intervention kids, I'd say what I see the most are those attachment issues and trying to find ways to help separate a little bit so that parents can use the bathroom without, having their kid cry for 5-10 minutes, just, and that breaks their hearts as they're trying to use the restroom, or being able to drop them off at daycare, anything like that. Those are the big things that I see right now.
And I see Holly said how to document history, trauma history, when no one wants to discuss I'm not sure if you'll be able to see the comments in the playback of this. You won't? Okay, so I'm going to read them. Elizabeth says, I'm in a trauma-informed setting, so we do have a lot of PDs on what complex chronic trauma looks like. A lot of things like this are great reviews. That being said, I see a lot of verbal and physical aggression. I also see kids just getting stuck in loops a lot, kind of like a feedback loop that we help them break out of. Elizabeth, do you feel like you're successful in breaking them out of the loop? And as she answers that,
Oh, I can respond verbally if you want.
Yes, I would
So
love that.
it depends on the kid. So I was just in the process of typing an example out, but it was going to be very long. So for example, I have a student that comes in on a daily. I want to go and see the principal. Well, your expectation is to be in the classroom. I want to go see the principal. Your expectation. And so we just kind of, you almost sound like a broken record until
Mhm.
eventually they come back with why.
Mhm.
And then it's, well, remember the principal has told you in the past, if you're in the classroom, she will come and see you. And so I do the broken record method because eventually they're gonna come back with a challenging why? Why is this my expectation? Because of this.
Mhm.
And the response then is either they walk out of the classroom, in which case they're kind of meeting their need anyway, or they might sit down or they might throw some stuff, but eventually we get them to a place where, okay, awesome. I love that you're meeting that expectation. Now I'm going to have the principal come and see you. And sometimes it takes 5 minutes, sometimes it takes 2 hours. It depends. Does that make sense?
It does make sense. I'm filtering it through my functional behavior assessment brain that wants to just immediately start talking about like the functions of the behavior
Mhm.
and interventions for that. And I'm like, no, stay trauma, stay on topic.
I feel
Um,
that. I feel that.
but there are in my references, there are some great papers if you're interested
Sure.
that do talk about functional interventions. And in a later slide, there is, what are some of the things we can do using applied behavior analysis and trauma-based care or trauma-informed care put together. How can that help? And one of the answers to that is function-based interventions that are also trauma informed. So, just totally hypothetically coming off your example, let's say that kid has, we find out he has a history of trauma that relates to neglect.
Mhm.
Um, as a behavior analyst, my trauma informed intervention would want to note that it's attention maintained behavior from the principal, and that the loop that we're stuck in is probably a verbal loop that is either reinforced by asking or automatically reinforced. And then once we figure that out, have an intervention and not use the, what did you call it? You called it something very funny, record.
Oh, the feedback loop or the
uh,
broken
Broken
record.
record. We say do the um, and that's where ABA comes in to
Mhm.
help decide how to make trauma-based or trauma-informed decisions when we're doing an intervention. And
For sure.
I'm
Yeah.
just going to use this example because it's you're brave, so you gave yours. But um, knowing our students and clients, and there's a question here that Holly posed about how, but we don't have documented, trauma history if no one wants to discuss specifics. Where I love ABA is that with ABA, we don't necessarily have to have the full background of the traumatic happenings. We can take data on what's happening at school and how there is a functional relation between what the client is exhibiting. I say client because I'm in a clinical space, you guys are students, so I'll try to get that right in my head. So when you get a student, being able to look at the behaviors, match them with the functions, match them with interventions, and then keep the data to understand, is this something that is indicating trauma with our easy checklist that's up there? Or is this something that needs to be further looked into? Or is it as simple as a broken record and when the principal comes in, everything is fine? One of the main reasons that this topic is so important in schools and in environments that you are all in is that we don't often have the trauma history. And it can be because no one wants to talk, or it can be because this is a adoption case and we don't have all the paperwork yet, or we're getting a kid from DHS and it's going to take 6 weeks for everything to be mailed over, but there's a very important document in there that lines it, and we just don't have it. So when we're thinking of the behavioral lens, we're looking at things that are happening in front of us and that we can, hate to say be in charge of, but at least that's our our starting point to get to what our students need. Um, I hope that my PowerPoint is not going to match as well with how we're discussing, like the order that we're discussing things. So please forgive me for that. When we're done and I send over the references and the checklist, I'll put it in the order that we discussed it. So I'm going to pause there. Questions, comments, additives? No, everybody's like, okay, we're doing fine. So as we're looking at behaviors from a behavior analytic point of view, we're looking at what we can see on the outside. We're writing down and taking data on what's happening. What I see often when I go into schools is that teachers will say, well, I know he did this on January 15th because I wrote an email to mom and I have this little notebook and I write everything down in my notebook, but they have not ever put all of those things in sequential order so that we can see if there are patterns happening or if there is anything that is sticking out that we can point to, start to analyze and see if an intervention needs to happen there. And so with all of your settings, one of my recommendations is to keep track of these type of behaviors, the ones that you see over and over again, the behaviors that you maybe even find most annoying or most disruptive. You're the one that's the head of your classroom or the head of your setting. So if you're seeing behaviors that are out of the norm and they're disrupting the entire environment, then there's likely a behavioral intervention that can ease or eliminate that behavior altogether. And after that, it's just about finding a mix of the correct behavior intervention and matching it to the behavior. Which, if you're not a BCBA and you don't know much about ABA, that part may need to be done by a behavior analyst, by your school psych, or maybe by a special education teacher that's your behavior specialist. So if it feels like, that's a little more than I could take on, it may not be the role for you. But knowing that it's possible provides some insight on maybe I just need to get help outside of my setting. I'm going to go back to the comments. I have one that says, from a parent's lens, emotional dysregulation without apparent causes, which lines up really nicely with keeping the data, whether you want to keep it in narrative form or if you want to do tally marks on behaviors and students that may be indicating trauma, that have recorded trauma, or that you've tried other interventions before and they're not working. I know that most of you said, you've had training in trauma-informed care and PD. So we know how trauma affects the brain. We know about the brain chemistry. We know all of this technical side of what's inside of the body and what's going on. And behavior analysis is going to be that final piece where we see, okay, what does this look like in the real world? What am I seeing with my eyes? And then how do these behaviors that I'm seeing with my eyes, these observable behaviors, how do they equal some kind of picture of what's going on in this child's environment? So that may look like you putting and I hate to use puzzle because puzzle is often associated with autism, and then people only think that I'm talking about autism. But I'm think of the whole child as and the problem behavior, disruptive behavior, and then each of those pieces of data, plugging them together to figure out what does this look like. Not only what are the functions of the behavior, but is there something driving the function that I'm not seeing with my eyes right now? So emotional dysregulation, for example, we know with many of the DSM-5 definitions of neurological disorders, that emotional dysregulation can be just part of the disorder. So, without apparent causes is something that, if you're looking through a behavior analytic lens, you can start to break down what are potential causes. Look at the environment. Are we seeing any reactions directly after things happen? Every Monday morning we have a huge blow up, and for the rest of the week it's like, oh, smooth. And then Monday comes again, and then it's all over again. Then maybe Monday's the day we need to look at what's going on or what's going on Monday. Well, the kid, from the teacher's point of view, we're saying, well, they come in dysregulated. Excuse me. They're coming in dysregulated. We don't know what's causing it. As a behavior analyst, then we're going to say, okay, then that's part of the environment. They're bringing this with them into the environment. Then before we can get anywhere, we must de-escalate. And using behavior analytic interventions, you may be able to de-escalate to the point where you're able to get an answer if you work with a population that has the skill to explain thoughts, feelings, emotions, what happened. And if you're working with a population that doesn't, you may stop at the child gets dysregulated over the weekend. When they enter school on Monday morning, they are not regulated. It's happened 4 weeks in a row. I would bet that it happens tomorrow, or next Monday again. We're going to set up an antecedent intervention, so when they come in, they are prepped to have the best day possible. We're prepped to have the staff to have the best day possible, and we're not inflicting more trauma trying to push through behavior plans when we know the client or the student comes in with this every day and they're not in a state for skill acquisition. Elizabeth said on the chat, we know at my work that the day before and after long weekends are hard for our kids, so we try to do the fun things on those days and allow grace when they don't or when they have coursework to do. I absolutely agree that that's a fantastic solution that is behavior analytic. We're decreasing how much response effort is required from our students on days that we have analyzed from past data. These are hard days. And most often what I see is school districts, and it doesn't seem, at least from what you've all said to this point, that this happens, but maybe in someplace that you work with, is that we have administration and or instructional coaches that are really pushing timelines. And so we have to get through this time, we have to get through that by that time, and we don't have the flexibility to the day before and the day after kind of take it easy. Part of your role as a trauma-informed educator or clinician may be advocating against the timeline that a curriculum coach has set, because your client student can't perform what they need to perform. And when we ask them to, we actually evoke problem behaviors that we could have avoided and we could have kept people safe had we waited until the child was regulated, or adult was regulated in a way that allowed them to move through the demands that we're going to present. And so that is a large component of when I consult. We get all the way down to the problem, we figure out the function, we get an intervention ready, everybody's ready to go, and tomorrow is going to be the Christmas party. And I'm like, oh, hold up. We gotta, we need to be a little softer. We need to give more grace. We need to have more reinforcement, maybe more breaks, maybe more movement. And then immediately it's like the behavior plan. And so inside of the behavior plan, or as an addendum to the behavior plan, it might be helpful to have some kind of fallback plan. So where I work, we do mood scales. So we only introduce skill acquisition goals when a student is in a happy, relaxed, engaged state. Now, that's not that we don't do anything if they're not happy, relaxed, engaged. We only do skill acquisition then. And if you're a fan of Greg Hanley, if you're a behavior analyst or a behaviorist, Greg Hanley is amazing, and I've lots of my inspiration comes from his work, and so that'll be shared in the references. But then we counter that happy, relaxed stage and learning, and then we also realize that there may be states of dysregulation where we are just focusing on staying regulated. That is the goal of the time, so that we can decrease any physical aggression, any verbal aggression, although I will be very transparent that it is a lot harder to decrease verbal aggression than physical aggression. Takes longer. It's just usually just more difficult. But we're to a place in the science of ABA where if you have a client that's being physically restrained, if they're being physically handled, escorted to a bus, transported, there's enough research for me to say with quite confidently that it's traumatic to be restrained. It's traumatic to be transported and carried from room to room. When I say no, I don't want to, and then somebody just puts me in a bear hug and takes me, we have quite a bit of research showing that, especially for autistic clients, but not only autistic clients, that they report once they're older or they're able to report to someone that that is actually compounding the trauma. And so I want to move to a slide, change my slide, so that we can discuss a little bit of preventing and recovering from vicarious trauma, understanding vicarious trauma and its symptoms, strategies for educators to prevent vicarious trauma, and then I'm not going to mess with this PowerPoint. I'm still a little shaky on my two screens, so we're just going to go with the format. But some of those strategies are setting professional boundaries, self-care routines, seeking support and supervision, and steps to recover if experiencing symptoms of vicarious trauma. So just in the same way that, being put in a bear hug and being held until you agree to stop doing a behavior can be traumatic, can also be traumatic to hold a child in a bear hug and they're kicking and screaming and spitting and biting, and you're holding them and you leave work that day and now you feel traumatized. And I think as a field of care providers for the population that we provide services to, we often skip over how our protocols, our safety protocols, can cause trauma. Even though they're keeping us safe, they could cause trauma on the clients and students we're using them with. And then also, when we're using them, we may be getting vicarious trauma or traumatizing our paraprofessionals, our teachers, or our RBT staff because they've had to hold someone against their will. And that is something that I don't feel like it's talked about enough. When I mentioned it, I saw a couple of heads like shaking slightly, and I'm sure everyone has a story of where they've been hit or bit or kicked, or they've had to watch a restraint that just made their stomach turn. That's a really important part that we don't talk about. And if it happens to the students, then it can happen to the teachers. If it happens to the teachers, it can happen to the students. So in our feedback loop that Elizabeth mentioned earlier, not only do we see these loops occurring with just the pattern of behavior that we're seeing in the classroom, but then we accidentally get into the loop. And then when we get into the loop, now we're traumatizing each other because when you do that, I have to hold you, or I have to do a timeout, or I have to put you in this, or we have to wait. And that's something we would like to avoid by having antecedent interventions, knowing how to look out for signs of trauma so that we're not traumatized ourselves or traumatizing others. And then noting that, hey, this is something that might be a little over my skill set, bandwidth, resource, you name it. Maybe you could do it if you had 5 less kids on your caseload, but you don't, and so you can't. And seeking support and supervision for these problems is a great way to solve them when you're feeling like you don't know what to do next, and you're in that feedback. You've now gotten yourself in a feedback loop or a loop of some sort. So I'm pausing to read the comments, but I would also love to hear any questions, any thoughts, any stories to share about preventing and recovering.
I think a big part of recovering from that vicarious trauma that you were mentioning from the restraint, because we actually had a very high risk situation at work today, which is why I'm sitting here with my cross stitching. This is my come down from it method. We had a few staff get hit. We had a few staff get kicked. I actually had to leave early because my glasses got stepped on in the whole situation and had to go get my glasses fixed. And the big part of it for me is we always want to try and check in with everyone involved as soon as we can. So, like, obviously, today I wasn't able to go and check in with any of the students that were involved. But we did do check-ins with the staff that were in the school. One staff lost a healthy chunk of hair off the top of her head. So we were just kind of checking on her. Are you okay? What do you need right now? And just kind of supporting each other and making sure that everyone feels supported and heard, I think is a big thing. Because we can't help the kids if we can't help ourselves is the big thing, I think.
I agree 100%. I'm so sorry that happened, by the way. That is a hard day. I'm glad you're cross stitching to escalate, and you're here today to this. I mean, you're following the steps of seeking, support and supervision on this. Hopefully, we can give you something that you even if it's support and not new knowledge of you're not, you're doing things as you should do, and we want to reinforce those.
And the other big thing is, like, there were some things that went down during it that I keep catching myself. Well, why didn't this person do this? Well, because that person probably didn't realize they needed to do that. So just cool your jets, brain. And so that's that feedback loop happening.
Yeah, absolutely. Absolutely. And we see, I love examples like that when we see ourselves and our students doing similar things, because it helps provide grace to the students, and it also helps bring humanity to the situation of, it's human nature for your brain to just be going, and it's also human nature to miss stuff and overlook things and not get things right every time. So knowing that as we go in, and knowing that as we pick interventions, and knowing that as we seek support is always extremely helpful. Any other comments or any questions? So as we are, going from Elizabeth's story into her checking on herself and her self-care and her and vicarious trauma, we're kind of looking at that. We can also separate these and say, okay, so that we don't get there again, can we teach strategies for emotional regulation so that our clients don't end up in a situation where they are hurting 4 or 5 staff members? And so these are some pretty general rules of thumb for strategies to incorporate in classrooms. But I often think that because they're so easy and because they can be simplistic, that maybe we don't use them enough, or we know that they exist and we know that they may work, but we're not using them consistently or effectively. And so strategies for incorporating emotional regulation to the classroom: one, creating a safe and predictable environment. And this can be everything from using strategies to pre-warn your students when change is happening, like you'll be gone or a substitute, or remember it's Monday, you're coming back to school on Monday, things like that, to also same seating, general routines. This is all this is an evidence-based strategy for helping emotional regulation. The next one is modeling and teaching emotional regulation skills. So these can be taught face-to-face, showing, with your students. It can be taught through video modeling, it can be taught through skill acquisition programs or curriculums that are created for this. There's lots of opportunities, but sometimes the child we're working with or the adult that we're working with has never had emotional regulation skills modeled to them in a naturalistic way, so that they can see what it actually looks like when you're really upset. If you have a chunk of hair missing, are you able to model emotional regulation skills? Is your staff able to model emotional regulation skills, even when it's really terrible? If you are working with a population that is not as observant, like your 0 to 6 year olds, you may have to model to them what you're expecting from them and model through the regulation process. So someone is upset, someone is dysregulated, modeling the appropriate regulation skills side by side as you're teaching them, and having your staff do the same. And if you can get parents on board, parents doing the same. So every time someone gets upset, they're acting the same way. What we know is that when we do that, we are building on our safe and predictable environment. I'm going to pause myself 1 second. I took a drink of water, and I was not expecting my husband to run behind me. So if it looked like you just saw Bigfoot behind you or something, it shocked me a little too. And then our next one is using de-escalation techniques effectively. And when I say effectively, we can send a list of de-escalation techniques that you can try. You can try every one of them, but it's really important to be using some technique that allows you to see if what you're teaching and if the techniques are actually being effective. So deep breaths, that's something that people often say, start with deep breaths. Having your client do deep breaths, is that working? If the behavior is still going on, then it might not be working. If you're not able to get down to a point where the student is back to what I call HRE, happy, relaxed, engaged, they're back regulated, they're back in control of their body and their hands and their mouth and everything, they are regulated, then we may need to see if there's a better de-escalation technique that is effective for this student. And with IEPs and in ARD meetings, I oftentimes see copy and pasted goals for de-escalation. And then I'll ask, does it work? And they're like, yeah, it works. It's in the literature. I'm like, no, but does it work for this kid? No, we've never gotten him to do it. Like, okay, we need something else then. We can't expect that we're going to change behavior if what we're introducing is not effective. Even if it's backed by the literature, there's so many individual components that are required that it may not be that easy. We may have to pair it with a functional assessment even to see if we can get traction on something that's really effective. Integrating mindfulness and relaxation exercises, even though this doesn't seem like the most behavior analytic thing, we're actually having a huge wave in behavior analysis of relational frame theory and acceptance and commitment training / acceptance and commitment theory, where having the students practice mindfulness and relaxation exercises are showing to be extremely beneficial with children and adults who have faced trauma, but also just the trauma of living a life when you are neurodivergent and or a minority of a category and a systemic system that really wasn't built for you. If you're in special education or receiving any kind of individualized treatment, then the system of school inherently was not built for you. We had to create a thing called special education, totally separate, where we do things different because what we were doing wasn't working. So keeping that in mind and understanding that there's already some level of possible trauma that could have been inflicted, and now integrating these may decrease that, so you have overall better emotional regulation with the person that you're working with. And then the last one on this is the behavior analysis perspectives, the role of reinforcement and behavior modification in teaching self-regulation. So breaking it down to the functions of behavior, if a child is wanting access to something or escape from something, looking at what actually reinforces their behavior, what increases the future frequency of self-regulation. If that is breakfast in the morning, then let's find breakfast in the morning. If we are noticing that the child is coming to school with something in the, Maslow's hierarchy of needs, is there something missing? Starting there, are we having some kind of setting event? Is there anything in the environment that we can tweak so that we can reinforce regulation? And the modification of both the behavior of your staff, the behavior of the client, and hopefully the behavior of the parents, because we know that as humans, we're affected by our environments around us. And so that might be a complete picture that you work on all three sides so that your student can find some balanced ground to gain self-regulation and emotional regulation. And then just practical activities, breathing exercises, identifying emotions. Both, you may have to start through pictures or videos, but then really seeing if your student and client can identify emotions in real time as something is happening. I have tons of clients that can pick mad on a choice board of a frowny face, but when their mom is actually mad at them, they don't have a clue, or their teacher is disappointed. They're unsure, but they can pick it on a card. So really knowing if they can identify emotions in their environment, and then providing really rich reinforcing activities and just reinforcement in general for using regulation strategies, but also being regulated. This may look like, I've had clients before where if we have really, really dangerous behavior, then as long as they're not engaging in the dangerous behavior, they are doing something reinforcing to them. Even if we're not doing any skill acquisition and we're not moving through our calendar or our whatever we're supposed to be doing, that we are using reinforcement and then fading that to add more, so that we don't have our kid off balance, expecting more than what they can do, and then being disappointed because we weren't able to reinforce. And I just glanced at the clock and noticed that it's 4:27. So I was not looking at the clock. I apologize. And in our 3 minutes, wrapping up, some options for personal resilience. As you're looking through this and you're thinking of, okay, how can I do this for my students? How can I do this for myself? Research is very clear. Develop strong support systems within your school, within your place of work. Fostering a growth mindset of I am here to make behavior change. We can make behavior change. And it's not every kid in every place that everything's going wrong. We can make change. We can make progress. And encouraging peer support and mentorship programs, which if you're here today, it seems like you already have a growth mindset and you're already reaching out for peer and mentor support. Maybe that looks like getting, emailing Jesse and saying, hey, I have this one kid and I have this question and I'm not really sure where to go from here, or continuing to come to these meetings so that you build your repertoire of different skills, so that you're taking care of yourself as well. And so because I have my references here, but I'm going to send these so that you can see them in a clearer way. I know we're like 2 minutes and some of you may have to log off right at the end. I have my stay in touch. If there was something that we talked about and you have a question about, or maybe a challenge, anything, my email's there. I would love to continue the conversation. If you are an Instagrammer, I have my Instagrams. If you're not, ignore those. If you don't have any questions, that's okay. You don't have to email me. But if you do, I'd love to hear from you. And then I guess with our 1 minute left, I'm just going to say, I really appreciate, Jesse, you inviting me here to talk, and everyone listening. Thank you so much. These are they're great to do. And I love hearing about what people are doing in different aspects of the field. And so if we didn't hit on exactly what you were needing and you're feeling like, okay, close, but I still have a question about this thing, please reach out to myself or Jesse, and maybe we can plug that in for you and get you the information that